Hello everyone. In this morning we are going to look at what we call malaria pathogenesis. We want to see how the signs and symptoms of malaria comes about. Then we are going to continue to look at the effects or what we call complications of severe malaria. And this one is going to be peculiar of P. which is known to cause complicated malaria, especially in Africa. And we start, if it is your first time, please, you are requested to subscribe. That is the only way you can support us so that we continue to make many videos. Like and share to many others. So with malaria pathogenesis, as we looked in the previous video in the life cycle, we saw this malaria is caused by the Plasmodium species, whereby we had Plasmodium falciparum, Plasmodium ovale, vivax, and malaria, whereby we have also Norris. So these are some of the parasites or the Plasmodium species we saw causing malaria in man. So we want to see when the Anopheles, female Anopheles mosquito, these ones are transmitted by female Anopheles mosquito when it is taking a blood meal. So the infective female Anopheles mosquito, we saw that it injects the infective stages, what we call the sporozoites. And these sporozoites, they were, after being injected, the sporozoites from the salivary gland of the mosquito move into bloodstream to the liver, and within the liver parenchymal cells, it develops into what we call schizons. And schizons of P. falciparum and malaria, within 1 to 10 days, they have developed and the liver cells rupture, releasing merozoites. But we saw species of ovale and vivax going into what we call dormant stages, whereby they develop into hypnozoites. These were the dormant stages, whereby after 1 to 2 years, they can cause what we call relapse malaria, whereby you have finished treating someone, then after some time, they get malaria again. That is in vivax and ovale. So after the schizons rupturing to release merozoites, we saw that the merozoites come and attach. These are the merozoites released from the rupture of the schizons within the liver during pre-erythrocytic schizogonal stage, that is the sexual stage, and these, they come and attach on the receptors on the red blood cell. So this is the RBC. After attaching on the specific receptors on the RBC, they transform into what we call the ring form, whereby the ring of the Plasmodium falciparum is delicate with a chromatin duct. Then others can have 2 chromatin dots. This is the ring form, is what we call the trophozoites. So these trophozoites, which are the ring forms, mature into what we call schizons. They mature into schizons depending on the species, and these schizons contain multiple merozoites. So this is the schizon within the RBC. And these schizons, after maturing, they rupture. So they rupture together with the RBC. So we are going to see the RBC together with the schizons undergoing rupture. And when this schizon ruptures with the RBC, it is able to release the merozoites. So the schizons was containing the merozoites. These are the merozoites, which it ruptures, releasing them into blood circulation. And each schizont contains between 6 to 32 merozoites, depending on the species, as we saw on the life cycle. So this is the merozoites which are released from the rupture of the RBC. When the RBC ruptures, it releases the merozoites. But it does not only release merozoites. Apart from the merozoites, we also see release of substances like hemozoin. Hemozoin is formed when the malaria parasites feeds on the hemoglobin. It forms hemozoin, and at the same time we form what we call malaria toxins and some oxygen reacting species. So these are the three things which are released. The one, it is the merozoites. The second one is the hemozoin. The third one is the malaria toxins. And we are going to see, and it is at this point when the erythrocytic rupture, during the release of the merozoites, the hemozoins, and the malaria pigments, we see the first signs and symptoms of malaria. So the signs and symptoms of malaria appear after the rupture of the red blood cell, releasing merozoites, hemozoins, and malaria toxins. So it is these toxins that they trigger the immune response. So when these toxins, they're going to trigger immune response, the immune system, to these chemicals known as cytokines. Cytokines such as interleukin-1, such as human necrotic factor alpha, such as interferon gamma. These are the cytokines which are triggered by the hemozoin and the malaria toxins to produce these. And it is this interleukin that is going to trigger presence of fever. So one of the signs and symptoms of malaria, we're going to see number one is fever. We're going to see headache coming in. We are going to see sweats, especially at night, sweats. We are going to see joint pains, then muscle weakness, whereby you become weak. These are all general signs and symptoms which occur after the immune system being triggered to produce these cytokines that are going to trigger the fever, the headache, the sweats, the joint pain, and the weakness, plus vomiting. We shall see vomiting and nausea. We shall also see diarrhea coming in. So these are some of the immediate signs and symptoms of malaria. In some malaria, like Plasmodium falciparum, we see what we call malaria paroxysms, whereby it will start with coldness and shivering. That is between 1 to 24 hours, between 1 to 2 hours. Then it is followed by fever. This fever can even go up to 40 degrees centigrade. Then it is followed by sweating. So these are the three phases of the malaria paroxysm, which can occur when you have malaria infection, whereby you first experience intense coldness and shivering, whereby you are seriously shivering. Then afterwards, the temperature increases up to 40, then followed by sweating. That is the malaria paroxysm, which we can talk about. Then later we are going to see how the malaria complications come about when the infection becomes severe after the delay to treat the infection. So we are seeing the malaria toxins and the hemozoin triggering the immune system to release the cytokines. And these cytokines we have seen interleukin-1, the tumor necrotic factor alpha, and the interferon gamma, triggering all these symptoms. After this, we are going to see that substances like the tumor necrotic factor is going to go to the blood vessel. This is the blood vessel. And this blood vessel is representing the microsaturation or the microcapillaries. And these capillaries are the ones that are supplying these different organs. It can be the microcapillaries and the postcapillary venues. We have also the postcapillary venues. So they are the ones which are mostly affected, whereby the tumor necrotic factor is going to trigger this blood vessel to expose what we call the adhering molecules, such as the ICAM and the VCAM. So it starts to express these adherence molecules, the ICAM, we are calling them the ICAM, and the VCAM, and the P-selectins. So there we also have what we call the P-selectins. So it exposes them. So when the blood cells, these RBCs, which are infected, as they are moving into the capillary beds, this is infected with the malaria parasite. Some of them undergo hemolysis. Those which are affected, as we see rupturing of these RBCs within the blood vessel, it is going to cause what we call increased hemolysis. So there is going to be a complication such as increased hemolysis of RBCs, especially the infected ones. And this hemolysis is going to lead into what we call anemia. So we're going to see one of the complications is anemia. Anemia is reduced HB or reduced RBC count and is being caused due to increased intravascular hemolysis, whereby the cells which are infected with red cells are being broken down. But we have seen when these cytokines trigger the blood vessels to bring their adherence molecules, and because of the peculiar thing of Plasmodium falciparum having the alcohol forms, it is going to cause what we call cytoadherence. So these blood cells which are infected begin to adhere to the endothelial lining of the blood vessel, and as they continue to adhere to one another, they cause what we call cytoadherence. So there is cytoadherence. They come and adhere to one another, and after adhering, they undergo what we call sequestration. So they are captured within these smaller vessels. And we are seeing I draw it big, but these small vessels are very small, that when the red cells adhere to the membrane or to the endothelial lining, they end up causing what we call blockage. So there is a blockage of these smaller vessels due to the adherence of the infected red cells with the parasite. So these infected cells adhere and they end up blocking the vessel. So meaning there is no more blood flow to the organs which are supplied by these smaller capillaries. At the same time, it triggers what we call inflammation. Apart from blockage, it triggers also inflammation. We are going to see inflammation happening, especially acute. And this one increases tissue permeability. So we see blockage and inflammation occurring. And because of cytoadherence and blockage, it is going to trigger what we call hypercoagulation. So it is going to trigger coagulation, that is blood clotting. And this coagulation, it involves the use of platelets. So platelets are going to be used up, leading to a condition known as thrombocytopenia. So we are going to see thrombocytopenia in malaria as a complication due to the coagulation cascade triggered after the sequestration or the cytoadherence due to the blockage of the blood smaller capillaries and the postcapillary venues. So this coagulation has led to thrombocytopenia, and inflammation can lead to leukocytosis. This one can lead to increased white blood cell count, so especially the neutrophils, because neutrophils are the ones that are participating majorly in this inflammation. So when you do a CBC, when you carry out a complete blood count, CBC of this patient with the severe malaria, they're going to portray, that is, increase the neutrophil count. Sometimes, not all the times, they can have white BC count high when there is inflammation, and then many times there is always low platelet count, which we have called thrombocytopenia. That is on a CBC. But so this one has become the second complication. That is thrombocytopenia. After seeing that one, another cause of anemia and thrombocytopenia, apart from increased destruction of the red cells and increased usage of the platelets, it can also be due to the blockage or inhibition of hematopoiesis. These tumor necrotic factor and interleukins, they are also believed to trigger or they are believed to inhibit hematopoiesis process, whereby they slow down the hematopoiesis process. So there is little compensation of what is being destroyed and what is being produced. So those two conditions, increased destruction and decreased hematopoiesis, leads to anemia and thrombocytopenia. Then leukocytosis is due to the local inflammation due to increased tissue permeability. Then after seeing that, look at this blockage which has happened. So the blockage of the blood vessels. Suppose this capillary was supplying the brain. If this is the brain, and this small blood vessel is blocked by the adhered RBCs which are infected with the malaria, it is going to lead to what we call cerebral malaria. So the complication number 3 becomes cerebral malaria. And this cerebral malaria, due to the blockage of the capillaries supplying the cerebral or the brain, it is characterized by signs like convulsion. The patient is brought convulsing and sometimes with seizures. This is how you know that someone has got cerebral malaria due to increased parastemia, peculiar of Plasmodium falciparum. Another one, suppose this small capillary is supplying the kidneys, and the blood vessels supplying the kidney are destroyed. There is no more supply. So when there is no blood supply, it means there is no oxygen, and no oxygen, it leads to ischemia, and ischemia leads to tissue necrosis. So we are seeing all these organs undergoing acute necrosis due to lack of oxygen supply and blood supply. Hypoxia, that is when the blood is not reaching, leads to ischemia. Then ischemia leads to these organ necrosis and the long run death or damage. So this kidney, when there is no enough blood supply, it is going to also undergo ischemia and then tubular necrosis, especially when these glomerulus, the capillaries supplying the nephron, this is the kidney nephron, are destroyed. It is going to undergo tubular necrosis, leading to renal failure. So this one results into what we call renal failure. And sometimes, so this one becomes complication number 4, renal failure. Another thing, increased intravascular hemolysis is going to lead to release of free hemoglobin in blood, leading to a condition known as hemoglobinemia. There is hemoglobinemia, and this hemoglobinemia can result into hemoglobinuria. Hemoglobinuria. That is presence of free hemoglobin in urine. So we are going to find that there is much hemoglobin. Since there is much hemoglobin in the blood, this hemoglobin is going to be found also in urine. So there is presence of hemoglobin in urine, which we call hemoglobinuria, leading to a condition known as black water fever. Black water fever seen in severe infection of Plasmodium falciparum, whereby the urine appears dark brown urine. So when you're producing dark brown urine, we can suspect the presence of free hemoglobin when you have malaria, and that one implies severe Plasmodium infection. So this is also another complication or another sign which can tell you that you have malaria. That is black water fever, or producing dark brown urine due to presence of free hemoglobin from increased hemolysis. Then let us continue with the organs. Suppose this capillary is supplying the lungs. These are the lungs. We have here the lungs. So if it is blocked, it means it is going to lead to tissue hypoxia, that is lack of oxygen, leading to necrosis of the lungs, and it will result into a sign what we call respiratory distress, whereby there is difficulty in breathing and sometimes wheezing because of the destruction of the parenchymal cells of the lungs, leading to respiratory distress. So another complication can be, this was number 5, black water fever. Number 6 is respiratory distress, when there is no oxygen supply and blood supply to the lungs. Then what if the supply is to the placenta? We have here the placenta. This is a pregnant mother. So when there is a blockage of the blood supply to the capillaries within the placenta, it is going to result into hypoxia. Hypoxia can lead to what we call fetal restriction growth. So the fetus, this fetus we are seeing, is restricted from growth due to lack of oxygen supply and blood, which brings up nutrients. And this one, sometimes this fetal restrictive growth can result into preterm birth. So this one can result into what we call preterm birth. Preterm birth, whereby this baby can be born before reaching 9 months due to lack of oxygen supply to the placenta. So that's why malaria is dangerous in pregnancy, and that's why we normally give them Fancida as a prophylaxis. And any malaria in pregnancy is treated as severe. Even when in the lab you see malaria +1, it should be regarded as severe because this placenta harbors much of the malaria parasites. So any malaria in pregnancy is treated as severe malaria because of its complication. So this complication becomes number 7, whereby we are seeing fetal restrictive growth leading to preterm birth, seen in malaria. Then what if this vessel is supplying the liver? This is the liver. So lack of oxygen, it is going to lead to ischemia, ischemic liver disease and liver necrosis, and it can result into a symptom known as hepatomegaly. It results into hepatomegaly. And sometimes this liver failure can result into what we call another complication, which is known as hypoglycemia. So there is another complication known as hypoglycemia, that is reduced glucose levels. So we have number 8 as hepatomegaly, number 9 as hypoglycemia. This hypoglycemia can be caused by liver failure, because we know carbohydrate metabolism majorly occurs in the liver. That is glycogenolysis, glycolysis occur in the liver. So if there is a problem with the liver hepatocytes, we can see hypoglycemia. And another thing, we see that these RBCs with malaria parasite, they tend to consume a lot of oxygen to release a lot of glucose so that they can get energy. So the parasites uses our own glucose to multiply and survive. So that one can also result into what we call hypoglycemia. Then another cause of hypoglycemia can be when you're giving a malaria patient quinine without checking their sugar levels, or without using D5 or sweet drink. It can result into hypoglycemia. So hypoglycemia can be caused by liver failure, failing to do its carbohydrate metabolism. It can be due to the malaria parasite consuming the oxygen in its process of multiplication. It can also be due to the drugs like quinine, which can cause hypoglycemia. So that is another complication we can see. And what if the blood vessel supplying the heart is the one blocked? It can result into what we call myocardial infarction. That is the heart attack, which is the 10th complication in malaria. So these are the complications we can give you in malaria, where we have seen number 1 was anemia, and this anemia was leading to presence of free hemoglobin due to increased hemolysis of the RBCs which are infected, leading to hemoglobinemia, that is a lot of hemoglobin in blood, which results into hemoglobinuria, which we have called black water fever. Then we have seen another complication, number 2, such as thrombocytopenia, due to the trigger of coagulation in the blocked blood vessels. Then we have seen cerebral malaria characterized by convulsion and seizures. Then we have seen renal failure due to lack of oxygen supply and leading to tissue damage, resulting to renal failure. We have seen respiratory distress due to lack of oxygen supply, leading to tissue death. That is ischemia and liver necrosis, lung necrosis, leading to respiratory distress. Then we have seen fetal restrictive growth and preterm birth due to the lack of oxygen supply to the placenta due to the blocked blood capillaries. Then we have seen also hepatomegaly and hypoglycemia together with myocardial infection. So in summary, severe malaria can lead to what we call multi-organ failure, multi-organ damage or failure. That is what we can see. So when you're managing malaria patients, you ought to rule out brain, that is cerebral malaria, by looking at the signs of convulsion and seizures, and that is emergency. You have to do a CBC to monitor the platelet levels. You have to go ahead and do urinalysis to see if there is presence of free hemoglobin in urine by looking at black water fever, which looks like dark brown urine. When you're managing malaria patients, you're requested to do what we call renal function tests. These renal function tests will enable us to monitor the functioning of the kidney, to discover if there is any kidney damage in the liver by looking at urea and creatinine levels. So you are requested also to do RFTs to monitor the kidney. We can do lung capacities to see how the lung is doing in case someone presents with respiratory distress. We can also go ahead and do some liver function tests in severe malaria to rule out problem with liver failure. And we can also do cardiac markers like troponin and CK to look at if there is any damage to the heart. So these are some of the tests you can do when you're managing malaria. We can do tests like renal function tests to look at the kidney, lung capacities to look at the working of the lung. We can do CBC to rule out anemia and thrombocytopenia. We can do liver function tests to check for the functioning of the liver and the cardiac markers, not forgetting glucose levels to rule out hypoglycemia. So these are some of the complications that cause death in malaria patients. So making sure if you're a doctor, you're a lab person, you're a nurse, always monitor all these things when you're managing severe malaria, especially due to Plasmodium falciparum. Thank you so much for learning with us at Medical Sciences. Hope you have enjoyed. Remember to subscribe, remember to like the video and share to many others so that they continue to learn with us. Thank you so much.